Hello, and welcome to this information session on Langara's gerontology programs. You can always go for a more complete and live information session by looking on our program webpage, Langara College Gerontology, signing up for one of our monthly info sessions where we will have the program coordinator and faculty and Langara recruitment staff available to answer your questions. Today we're going to talk about what our program is, a little bit about what gerontology is, of course, to make sure you're listening to the right information session, the employment opportunities, and our program credentials and descriptions, and of course, the application process. So what is gerontology? Gerontology is the study of the social, cultural, psychological, cognitive, and biological aspects of aging. As a field, it's interested in learning about how older adults shape the population and how population aging shapes individuals. And for the first time in census history in Canada, there are more seniors 65 years and older than there are children under the age of 15. In British Columbia in particular, we have 7 out of 10 of Canada's oldest communities. And in terms of employment, this is great news. In fact, the BC Labour Market Report of 2023 reports that as BC's population continues to age, healthcare social assistance work will see the largest increase in job openings over the next 10 years. And so identified as part of the care economy, social service and community service workers are listed as one of the top 5 occupations with over 30,000 job openings in British Columbia between 2023 and 2033. So our program options are a 1-year social service worker program, which has a different title. It's a social service worker bracket gerontology certificate. And then we also have the diploma in gerontology certificate, which is 2 years. And I'll explain how they ladder together. Essentially, the social service worker certificate is the first year of the diploma in gerontology program. So our social service worker gerontology certificate, as I said, is 1 year long. It's very similar to the social service worker program run in the social service worker department at Langara College. However, this has a special focus on older adults. Our program is taught through a social work lens, which means we use a strengths-based and social justice approach to how we construct aging, how we look at aging, how we support aging. And of course, it is interdisciplinary because gerontology as a field is interdisciplinary. So it includes courses in gerontology, psychology, recreation, and English. Really, the goal is to give students a broad understanding of aging processes and social policy issues affecting older persons and their families. And the highlight for many students is the practicum placement, where you have a direct experience in the senior serving community by completing over 200 practicum hours. And we work with students to find those placements. It's not just assigned. So our diploma in gerontology then is an added year. So you would go through the first year altogether as a cohort. Some people would graduate with a certificate. Other people would choose to go on to the diploma in gerontology. And these are for students wanting to develop more advanced skills and knowledge to work in the community-based senior service sector. So the next 2 terms would introduce courses that have more application to leadership, managerial, and programming positions. And there is also an additional practicum. So in total, students would be graduating with 300 hours of experience in the seniors-based service sector. There's a few unique aspects to our program. And the first one is that we are the only entry-level gerontology program in BC, meaning A person does not have to have a prior degree or certification in order to enter. We do have on-campus and face-to-face programs, which really enhances the learning, understanding, and network building between students. Our environment in the classroom is very small and intimate, so you really get to know your instructors. Of course, the practicum placement is unique as well, and is a very valuable component in our program. We also have the interdisciplinary component. So students are not just learning gerontology from us in our department, but we have collaborated with other departments like psychology and recreation and health sciences to create aging curriculum in those disciplines. And our faculty are knowledgeable, and we collaborate with professionals in the field. So we have continued connections and understanding of what's going on out there in the field for older adults and older adult services. We do a lot of field trips. We like to take our students out to community organizations and begin to build that network so that they know the landscape of senior services for older adults in the Lower Mainland when they graduate. And throughout the program, of course, we have, other than just the practicum and the field work, we do have a lot of other community connections. We like to bring in guest speakers and use examples of projects in our classrooms to talk about and make sure that students, when they leave, have a good understanding of, as I said, what's out there and what's going on currently for older adults in the Lower Mainland. Those are just some examples of guest speakers that we've had in the past. In the sort of center there, we have a speaker from the Dignity Senior Society because people age in diverse ways. And so this is an example of a community organization supporting LGBTQ2IS plus older adults. We have another example on the top right of two retirees who come to talk about how they have made the transition and what they enjoy about their retired lifestyles. And then we have on the bottom right, we have an international speaker speaking about the model of aged care in Australia. Practicum, a lot of students are attracted to this program because of the practicum placements. And so overall, the goal is to provide students a chance to apply the theories that we're talking about in the classroom to a variety of settings that support older adults. So there's a large range of places where we have had students go for practicum, ranging from neighborhood houses, adult day centers, healthcare settings like long-term care, private assisted living facilities, the Alzheimer's Society, research practicums, and which span, of course, the range of things from recreation programming to more program planning and evaluation. So there's a real range of possibilities and things are always coming up. And we like to collaborate with students on where would be a good fit with their prior work and education experience and their interests. Throughout our program, we really emphasize that we want to change perceptions of aging, that the negative stereotypes of aging are not correct. They're not true to people's lived experiences, and that also older people have a lot to share and are valuable members of our society. We want to focus on how we can reduce isolation among older adults and keep them connected to our communities. In doing so, we want to address ageism and challenge those stereotypes that limit people as they age and cause barriers for them to accessing services. And we want to help older adults to age in place by looking at our communities and our relationships and how we can support one another. Just a mention here about different employment and educational streams and what we're talking about. Geriatrics is the healthcare field of studying aging or working with older patients. So we're gerontology, not geriatrics. But if a person has a health or medical background, they may find that this is a great complement to what the knowledge they already have, and they can add an aging friendly lens to their practice by going through the program. Other students have a real interest in recreation, so they can combine this with backgrounds in recreation therapy or also similarly recreation assistance and general interest in helping older adults stay active in their communities. Gerontology, so maybe more of a social science research focus, depending on your background and interest. And of course, these courses are social service worker courses, so they will be able to be transferred to several different institutions around British Columbia and help people move into a career in social work if that's their goal. So what kind of jobs are we talking about? First, there's the direct service jobs, which include things like working one-to-one with older adults in settings for recreation, for therapy, for support, for advocacy. So working in, providing actual programming and welcoming and supporting older adults who use that programming, like adult day centers, neighborhood houses, food security programs, information and referral, housing support, and system navigation and advocacy in those ways. Within those jobs, there's often a degree of program planning and evaluation that's involved, and some people who leave our diploma program are very interested in that aspect of employment. Other students have gone on to find work providing education and training for individuals and communities, for example, working with the Alzheimer's Society or with neighborhood houses to provide educational programming for caregivers, for older adults with particular conditions like living with dementia or maybe certain disabilities or illnesses. So providing sort of empowerment-based training for those groups. And then some people move on to look more around administration and policy. So working with, different community agencies and sort of moving to a higher level of practice through policy. And then other students are very interested in research and go on to pursue higher education for that purpose. In terms of our application process, we really encourage you to attend an information session because that's actually part of the admission requirement. Some of these stages can be conducted at the same time as one another. So for example, if you're an international student, you can attend an information session, but also at the same time, you should be contacting our international education office at Langara. And a person can also at this time be submitting our general Langara Gerontology supplemental application form. And at the time of submitting the application form, you'll want to have your transcripts mailed to Langara directly from high school to assess grade 12 English, to assess any other English credentials, their previous college or university, maybe for transfer credits or for other assessments that we need for admission at the college. So they need to come directly institution to institution. You can attach a copy just for interest's sake with your application, but they need to be also mailed directly or emailed directly from institution to institution. We also require Something a little additional for the diploma and certificate in gerontology program specifically, we require 2 letters of reference, not from family members. So these would be letters of reference from coworkers, instructors, employers, supervisors, people you have worked with in a volunteer capacity to explain why you'd be a good fit for our program and your interest in aging, if that's applicable. The other aspect is to have proof of 60 hours of work or volunteer experience in a human serving organization or capacity. So that could be anything from teaching, it could be teaching children, working in any sort of child care services, healthcare, faith-based organizations, healthcare background, anything of that nature to show that you have an interest in working with humans. It doesn't have to be aging experience specific. This is why we also are interested in your supplemental application, which is available on our website and webpage. The supplemental application will ask you to explain your interest in gerontology and how you learned about our program. So those are 2 layers of reference, proof of hours, and the supplemental application. I will be in touch as the program coordinator, and when all the application is complete, we will be in contact with you to schedule an interview for the program. Just want to mention English requirements. To explain this fully, it would be better to be in touch with the program. It doesn't really matter what country you come from, or unless you are graduated from a high school in British Columbia and took a specific curriculum, we will need proof of English requirements for entrance, and this is all on our webpage as well. There's our Instagram link there for gerontology. And if you're an international student, you may want to contact some of these links. They're easy to find on our Langara global website as well. And thank you for your interest.